Medical News Update and Purple Day. Welcome back to the channel. I'm your host bringing you your top medical news highlights for Thursday, March 26, 2026. Today, we have a major story changing what we thought we knew about a 60-year-old drug, a new ultrasensitive blood test for Alzheimer's, and a global WHO warning regarding healthcare in conflict zones. Plus, why you might want to switch up your smartphone usage. Today's briefing. Diabetes breakthrough, metformin acts on the brain? Alzheimer's diagnostic, Spear Bio's ultrasensitive test. Public health, COVID versus kidney disease risk study. Global news, WHO calls for safe haven hospitals. Tech corner, vivid dreams equals better sleep? Story 1, metformin's hidden brain pathway revealed, 60 years later. First up, a headline maker from Science Daily. Metformin has been the first-line drug for type 2 diabetes for decades. But scientists just discovered a massive secret: it works in the brain, not just the body. Details: researchers found that metformin switches off a key protein and activates specific neurons, creating a new pathway that lowers blood sugar. This discovery, published on March 25 and 26, 2026, could lead to completely new, more effective ways to treat diabetes by targeting the brain's role in metabolism. Takeaway: this changes how researchers look at metformin and opens doors for new weight loss and diabetes research. Story 2, Alzheimer's early detection, p-tau 217 breakthrough. Next, early detection of Alzheimer's is getting a huge boost. Spear Bio has just introduced a new ultrasensitive blood test for neurodegenerative diseases. Details: this new technology, Spear UltraDetect, can detect Alzheimer's biomarkers, p-tau 217, at incredibly low levels. We're talking attomolar sensitivity using just 1 microliter of blood. That is a tiny amount. Impact: this means earlier, faster, and more accessible screening for Alzheimer's and other neurodegenerative diseases, which is crucial for early intervention. Story 3, COVID-19 kidney risks persist, retrospective study. Moving to the lingering effects of the pandemic. A new retrospective study looking at data for over 3 million U.S. adults has found that COVID-19 poses a higher risk for kidney damage compared to influenza. Details: the study shows that COVID is associated with higher risks of acute kidney injury, AKI, chronic kidney disease, CKD, and end-stage renal disease, ESRD. While AKI risk is highest immediately, the risk for chronic kidney disease persists long after the initial infection. Takeaway: it underscores the need for continued renal monitoring for long COVID patients. Story 4, Global Health Update, WHO warnings. Globally, the WHO is raising alarm bells. Dr. Hanan Balkhi, the WHO's regional director for the Eastern Mediterranean, has stated a health crisis is unfolding in real time and is demanding a stop to hostilities in the region. Details: hospitals are being targeted, and the WHO is reiterating that hospitals and healthcare facilities must be treated as safe havens. Public health note: additionally, new WHO data shows that more than 60 countries now include refugees and migrants in their national health policies, which is a positive, yet still incomplete, step forward in global health equity. Story 5, Brain and Lifestyle Tech, Smartwatch and Dreams. Finally, quick health hacks for your lifestyle. Vivid dreams: new research suggests that having vivid dreams actually makes your sleep feel deeper and more refreshing, contrary to the belief that they disturb sleep. Phone usage: a study found that 2 weeks without mobile internet restored attention spans to levels typical of someone 10 years younger. Brain monitoring: CES 2026 highlighted new EEG headphones designed for consumers to measure brain activity during sleep and relaxation. Today is a special, and incredibly important, episode. It's March 26th, which means it's Purple Day for epilepsy awareness. What is it? Founded in 2008 by Cassidy Megan, a young girl from Canada who wanted to make sure everyone knew about epilepsy, this day is all about breaking stigma, educating the public, and showing support for the over 50 million people worldwide living with epilepsy. The mission: epilepsy can be isolating, and there's still a lot of misunderstanding, like thinking it's a mental illness, or that you should put something in someone's mouth during a seizure. Spoiler: do not do that. Purple Day is our chance to turn that around. What we're covering today, we aren't just wearing purple, we are talking about the hard stuff: SUDEP, late-onset temporal lobe epilepsy, and advanced diagnostic tools like video EEG. Call to action: if you or a loved one is affected, please watch to the end. Let's get into it. Segment 1, SUDEP, the hard conversation. Host, we need to talk about SUDEP. It is uncomfortable, but it is necessary. SUDEP stands for sudden unexpected death in epilepsy. Definition: it occurs when a person with epilepsy dies suddenly and prematurely, and no other cause of death can be found, even after an autopsy. It often happens at night, frequently face down in bed. How common is it? About 1 in 1,000 people with epilepsy die from SUDEP each year. It is the leading cause of death in people with uncontrolled seizures. Who is at risk? The biggest risk factor is having frequent, uncontrolled generalized tonic-clonic seizures, grand mal seizures. If you are having 3 or more of these a year, your risk goes up significantly. Other factors include not taking medication as prescribed, having seizures at night, living alone. How to reduce the risk? Seizure control: the number one way to lower risk is to stop seizures, especially tonic-clonic ones. Nocturnal monitoring, using bed sensors or alarms to detect convulsions at night. Medication adherence: never skip doses. I know this is scary, but knowledge is power. Talking to your doctor about your SUDEP risk is crucial for creating a safer management plan. Segment 2, LOTLE, late-onset temporal lobe epilepsy. Next, let's talk about LOTLE, or late-onset temporal lobe epilepsy. What is it? While many people think of epilepsy as a childhood condition, TLE often starts in adulthood, particularly after age 50. Why does it happen? It can be caused by strokes, tumors, infections, or sometimes it's associated with neurodegenerative processes, overlapping with early signs of Alzheimer's. Symptoms people with LOTLE might experience: auras, a rising feeling in the stomach, intense déjà vu, or sudden, unprovoked fear. Focal impaired awareness seizures, blank staring, lip smacking, or fumbling with clothes, often lasting 1 to 2 minutes. Why it's tricky: because it happens in seniors, these seizures are often misdiagnosed as panic attacks, TIAs, mini-strokes, or just confusion. Host, if you or an older relative are experiencing new, unexplained spells, please see a neurologist who specializes in epilepsy. Segment 3, video EEG, the gold standard. Host, how do doctors know for sure? They use video EEG, electroencephalogram. What is it? It's a 24-hour-plus recording that combines EEG, brainwaves, with video, physical behavior. The goal is to record a typical seizure and see exactly what the brain is doing at that exact moment. Why is it needed? Diagnosis: differentiating epilepsy from non-epileptic seizures. Localization: finding exactly where the seizure starts, which is necessary if you are considering surgery. What to expect: you might be admitted to an epilepsy monitoring unit, EMU. Doctors often reduce your medication to provoke a seizure so they can record it. It can be stressful, but it's the safest way to get answers. Alternatives: sometimes, if scalp electrodes aren't enough, doctors use invasive electrodes, depth electrodes, placed directly on the brain to get better data. Segment 4, RNS, responsive neurostimulation for seniors. Host, finally, some hope for those with refractory, drug-resistant, focal epilepsy, especially in seniors. If medicine doesn't work, we look to devices, and a major one is responsive neurostimulation, or RNS. What is it? Think of it as a pacemaker for the brain. A small device is implanted in the skull, and electrodes are placed on the areas where your seizures start. How it works: it constantly monitors your brainwaves. When it detects an abnormal pattern before you feel a seizure, it delivers a small electrical pulse to stop it. Why RNS for seniors? Many seniors cannot undergo traditional brain surgery, resection, because it's too risky. RNS is a less invasive option that has shown excellent results in reducing seizure frequency in seniors with focal epilepsy. Benefits: it doesn't just stop seizures, it records data, allowing your doctor to see your brain activity over months and adjust your care. Wrinkles prevention: don't squint. Squinting in the sun, or any other facial expression you make a lot, can cause wrinkles in certain parts of your face. If you're outside a lot, wear UV 400 blocking sunglasses. They may help protect you from early crow's feet as well as those UV rays. WebMD. Fatty liver is more widespread than you realize. Fatty liver could be the most common disease you've never heard of. At least 1 out of 4 adults have it. And lots of those who have it may not know they have it, or even what it is. Most times, this liver disease is mild, but it can lead to more serious health problems. Yet you can often control or reverse fatty liver with smart changes to your lifestyle. WebMD. Anxiety. Stress and worry aren't great germ fighters. Just having anxious thoughts can weaken your immune response in as little as 30 minutes. Constant stress takes an even bigger toll and makes it harder to fend off the flu, herpes, shingles, and other viruses. Talk to your doctor if you can't shake your worry or if it gets in the way of normal life. WebMD. Conclusion and call to action. Host: to summarize, today is about awareness. Epilepsy is complex. If you have uncontrolled seizures, talk about SUDEP. If you are experiencing new spells late in life, ask about LOTLE. Demand a video EEG to get a precise diagnosis. And know that there are options, like RNS, even for seniors. Final message: wear purple today, share this video to educate someone, and support epilepsy research. Outro: thanks for watching. Please like, subscribe, and drop your questions in the comments. Stay safe, and go purple. Which of these stories surprised you the most? Let me know in the comments below. Don't forget to like this video and subscribe for your daily medical news update. Stay healthy. Disclaimer: this script is based on general medical information and does not constitute personal medical advice. Always consult with a qualified specialist. All information must be verified before use. The creator, publisher, and YouTube will not be liable or responsible for any negative consequences.